Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Yeah. Now we have complications of mastectomy. Next, in the complications of mastectomy, first we have seroma. Right, seroma is the most common complication of mastectomy, which is occurs in 30% of the cases. And we can do wound infection can be is important in seroma. Wound infection is mainly due to the skin flap necrosis is responsible for wound infection in mastectomy. One more complication of mastectomy is lymphedema can occur in the mastectomy. This lymphedema occurs, it is actually less frequently seen or it is rarely seen in standard axillary dissections. But this lymphedema is actually seen in extensive lymph node disease. Whenever there is extensive lymph node dissection or in radiation therapy or in presence of positive lymph nodes or in obesity, in these cases there is increased risk of lymphedema. Then after lymphedema there can be injury to the long thoracic nerve is seen. Whenever there is injury to the long thoracic nerve, it is seen in 10% of the cases. It will result in palsy to the serratus anterior. Whenever there is palsy to the serratus anterior muscle, this will result in winging of scapula. Okay, then there can be injury to the thoracodorsal nerve is also seen. Whenever there is injury to the thoracodorsal nerve, in this situation this will mainly lead to the palsy of latissimus dorsi. Okay, this will result in palsy of latissimus dorsi muscle, and here you will see that there is redundant axillary fat pad is seen.
thank you and thank you for watching.